Hey guys, I'm Jennifer, also known as JBK. And for those of you who are new to the channel, my 13-year-old rat terrier lab mix, Ginny, was diagnosed with canine lymphoma. We have been treating Ginny with prednisone, which is a steroid, and we have been using an alternative treatment choice, which is cannabis oils. So Ginny takes cannabis oils 3 times a day, and then right before going to bed, I also give her FECO, which is full extract cannabis oil. I'll leave links in my description that get into more details about finding out that she had lymphoma and getting her started on cannabis oil and getting her started on FECO. But the point of this video is to just show you a little trick that I've found for getting just a little bit of FECO out of the syringe, which can be challenging. So the FECO I'm using for Ginny is 1:1. You can get FECO in stronger concentrations like 3:1, but Ginny's a small dog, and as it is, the 1:1 syringe costs $100. So for us, that fits our budget. But if you're going to get a stronger concentration, it's going to cost more money. The other thing to keep in mind is that sadly, we're still a long way off from a lot of evidence-based data that marijuana and cannabis-based products can help cure cancer, whether it's for humans or for dogs. But when Ginny was first diagnosed, I hooked into a really cool community on Facebook, and a lot of the members had really good results with using cannabis oils. You want to make sure your cannabis oils are actually from THC, not made from hemp. They're not sold at the local store. So over here, I have the FECO syringe, and then I have some treats for her, as well as her LDN dose, low dose naltrexone, and I'll talk about that in another video, but it's something that I'm trying. Okay, so what I do with the FECO is I open it, and rather than pushing down on the syringe, which for me has always meant I push out too much FECO, what I'm going to do is I'm going to put it on a piece of tissue. I line up the top of the syringe with something that is light colored. I can see the Kleenex over the top of the syringe. So what I'm going to do is, just to get it started, I'm just going to do a few gentle taps. Right? Now I'm very slowly, I'm just going to push down on the syringe, and already a little bit of the FECO has come out. So I'm just going to keep going, just a little bit more, and there we go. And then I wipe it on my finger, and that's what about 0.5 milligrams of FECO looks like. Okay, so now I'm gonna take this FECO with the Shez, as my daughter likes to call it, and give Ginny the FECO, and then she gets to have a few treats. Okay, let's go. She knows we're coming. Don't you, Ginny? I know. She knows. Look at her. Oh, I know. Just go ahead and get it over with. Here's your Shez. Now I'm just gonna put my finger in her cheek, and I rub the FECO against her gum. You want some, Shez? Right? That's a very good girl. What a good girl. I know you don't like it. I'm sorry. It could be worse. It could be worse, right? Could it be worse? Maybe. I don't know. I guess I've had worse things. Before I give Ginny FECO, I always wipe her teeth with a little dental wipe, and then I use that to wipe the FECO off my finger. It's pretty sticky. Do you forgive Mommy?
I'll think about it.
I'm dosing you with medicine you don't like. I'm sorry.
Oh, believe you me, I'll keep milking this one.
Before I sign off, I just want to give you a word of caution, which is to always keep in mind that something like FECO or cannabis oil is a psychotropic drug. That means it can alter your little pooch's mind, which means it's really important that you don't give them too much right off the bat. You want to build up to the dose that you decide you're going to give them, which is to say, be careful, you know? Because even though these little pooches can't speak, they know what it feels like to feel like they're going crazy if they have too much cannabis. Enough said.
I think you did so good. You're so brave.
I sure am.
Yes, you are. You're such a brave girl.
Yeah.
You're such a brave girl.
Yeah, feels good, Mom.
Yeah. You ready to go to sleep?
Yes.
Let's go to bed, okay? Should we go to bed?
Okay.
Let's go to bed. Good night.
Don't worry. You get used to the FECO.